Good morning to one and all, respected ma'am, sir, and my fellow batchmates. I, on behalf of my teammates, would like to present our project on COVID 19 or coronavirus. I'm sure everybody might be aware of coronavirus since we've been on a long vacation for a couple of months. But specifically talking about coronavirus, it is a virus that kind of spreads and has originated from the wet markets in Wuhan province from China. Initially, this virus originated in bats, which caused Middle East respiratory syndrome, severe acute respiratory syndrome, which then later spread to humans from the wet markets in Wuhan. The pandemic spread of this coronavirus. The coronavirus outbreak has been labeled a pandemic by the World Health Organization, keeping into consideration the global spread of this dreadful virus that has caused deaths of several people from all around the world. Nationally, Maharashtra has been recorded to have the highest number of cases, followed by Tamil Nadu, Delhi, and other states. India's rise in cases is the third fastest globally. Karnataka has also been recorded to have the highest number of cases, which increased gradually as time passed. Coronavirus are enveloped positive sense single-stranded RNA viruses which consist of phospholipid envelope, spikes and genetic material RNA. In the blood circulation, the virus increases capillary permeability, which causes decreased blood volume and the peripheral resistance, which leads to hypertension, leading to decreased organ perfusion and finally leading to multi-organ failure. There is no much difference as far as the symptomatology of the virus is considered than a common flu. The common symptoms are fever, fatigue, dry cough, loss of appetite, body aches, shortness of breath, mucus or phlegm. Emergency symptoms might be trouble in breathing, constant pain or pressure in your chest, bluish lips or face, and sudden confusion. Tests for coronavirus. Tests for coronavirus are swab test, nasal aspirate, blood test, tracheal aspirate, and sputum test. Vaccine trials. Researchers from all around the world are developing more than 155 vaccines against the coronavirus, and 23 vaccines are in human trials. Vaccines typically require years of research and testing before reaching the clinic, but scientists are racing to produce a safe and effective vaccine by next year. Covaxin is the India's first indigenous vaccine developed by the Bharat Biotech and has been successfully entered into human prevention and control of virus. Wash your hands regularly with soap or sanitizer. Protect others from getting sick. Practice food safety. What to do if person gets sick? Stay home except to get medical care. Separate yourself from other people in your room. Call ahead before visiting your doctor. If you are sick, wear cloth covering over your nose and mouth. Cover your coughs and sneezes. Clean your hands often. Avoid sharing personal household items and monitor your symptoms. Stay healthy while traveling. Avoid traveling if you have cough or fever. Wear mask in heavily crowded areas. When coughing or sneezing, use tissue to cover mouth and nose. Frequently wash hands with soap. Avoid direct hand contact with eyes, nose, and mouth. Avoid shaking hands. Avoid close contact with sick people and their tools. Avoid contact with the live animals. Avoid undercooking of meat, eggs, and raw fruits. Do not share eating utensils. Wash your hands regularly. Use mask regularly. Have temperature checked regularly. Avoid large crowd. Never touch your face regularly. Prevention by social distancing. Social distancing is practiced by people from all around the world in which people increase the physical space between them and avoid the spreading of this virus. High-risk groups are people who are at a higher risk from severe illness if they get COVID-19. This includes older adults, people who have underlying medical conditions like heart disease, diabetes, lung disease, kidney disease, and people who are on cancer medication and the pregnant women. Corona warriors are individuals who provide services in hospitals and community to diagnose, cure, reduce mortality, and prevent the spread of the coronavirus. These people are the people from the local bodies and administration, healthcare team, police department, information department. A big salute to the corona warriors. Stay motivated during this pandemic. This problem should not only be solved by the government but also by people who can support. So come forward, support the needy, stay united, stay strong, stay safe, stay home. So build your immunity, stay healthy and stay positive. Be supportive, be careful, be alert, be kind, and be ready to fight the COVID-19. So finally, we are all in this together. So stay home and stay safe. Thank you.